So, on behalf of my colleagues and our team, I'm excited to introduce the Adolescent Vaccination Program implementation tool to you today. So, the Adolescent Vaccination Program, or AVP, is an evidence-based program that was developed by UT Health and Baylor College of Medicine and funded by the Cancer Prevention and Research Institute of Texas. It has been implemented in pediatric clinic networks in Houston and San Antonio, Texas. And following the success of the AVP, we developed the AVP implementation tool, or AVP-IT, which enables further dissemination of the AVP to pediatric clinics in Texas. Next slide. So just as an introduction, my name is Mary Healy, and I'm an Associate Professor of Pediatrics in the Section of Infectious Diseases at Baylor College of Medicine and Texas Children's Hospital. I'm a collaborator on the Adolescent Vaccination Program, and I'll be presenting this virtual webinar today. Next slide. So, despite evidence of safety and effectiveness, HPV vaccination rates remain below the Healthy People 2030 goal of 80% completion by age 13. According to the 2021 National Immunization Survey, or NIS-TEEN, only 58.6% of boys and girls in the US and only 76% of teens had received one or more doses of HPV vaccine, while 63% had completed the 2 or 3 dose series, depending on their age when they initiated the series. Rates for other adolescent vaccines, which are the Tdap and the MenACWY, are much higher, ranging from 89 to 92%. So evidence-based strategies can help bridge this gap and reduce missed opportunities for HPV vaccination. The Community Preventative Services Task Force recommends several strategies that have been shown to be effective at increasing vaccination rates in clinic settings. In addition, they found strong evidence for using system-level implementation strategies to triangulate approaches at varied levels. That's the organizational, provider, and patient levels. Effective strategies to increase initiation and completion include provider assessment and feedback, provider reminders to let providers know when patients are actually due for vaccinations, patient reminder systems, and both provider education and patient education when used as a combined approach to increase vaccination rates. Next slide. So based on these recommendations from the Community Preventative Services Task Force, we developed the AVP, a multi-component HPV vaccination program for a large pediatric clinic network in Houston, Texas. The AVP comprises a number of parts. Number one is the HPV immunization champions within clinics, and these may be clinic managers, healthcare providers, and/or lead pediatricians that serve as facilitators of the rollout of evidence-based strategies and as advocates for their sustainability. Second is provider assessment and feedback reports, which provide a retrospective comparison to HPV statistics from the previous quarter and HPV vaccination goals for the coming quarter. Number 3 is an AVP provider continuing education video for pediatricians, nurses, and medical assistants. And this education video provides background on current HPV vaccination guidelines, up-to-date clinic system initiation and completion rates, HPV vaccination in the context of a medical ethics framework, the latest research on evidence-based strategies for HPV vaccination initiation and completion, and skill-building case simulations that model patient-provider communications, and further strategies to ensure all clinic staff provide accurate and consistent messages to patients during clinic encounters. This activity was approved for 1 hour of ethics CME and CNE credit. Number 4 is electronic health record-based real-time HPV provider queues delivered during the patient encounter to remind providers that the patient is due for HPV vaccination. 5 is tailored patient reminders to remind parents when their child is due for a dose of the HPV vaccine. And finally, 6 is parent education in the form of the AVP HPV Cancer-Free app. So HPV Cancer-Free is an iOS and Android compatible smartphone app provided to parents of patients aged 9 to 17 years who've not initiated or completed the HPV vaccine series. The self-administered app is designed to first raise awareness of HPV and the potential for cancer prevention, second, reduce barriers to HPV vaccination, and third, enable parents to schedule HPV vaccination reminders through their smartphone. Next slide. So this slide shows some examples of AVP strategies. So the first example is a sample physician assessment and feedback report, which presents individual adolescent vaccination rates and also compares the physician HPV vaccination rates to other providers at their clinic. In addition to the physician report, the AVP also utilizes a clinic assessment and feedback report that includes clinic level data for clinic staff and managers. Number 2 are some example slides from the AVP continuing education activity, highlighting the importance of reducing missed opportunities and parental hesitancy, including case-based vignettes. Third is an HPV vaccination prompt that providers receive in the electronic health record. And finally, number 4 is screenshots of real testimonials from parents who are featured in the Bust a Myth portion of the HPV Cancer-Free app, which aims to dispel HPV vaccination myths. Next slide. So the AVP was implemented in a large urban pediatric clinic network in Houston, Texas from November 2015 to February 2019. And it's currently being implemented in a clinic network in San Antonio, Texas. Results indicate that the AVP is feasible for clinic use and it's effective in increasing both initiation and completion of the HPV vaccine series among male and female patients, as you can see on the graphs on your left-hand side. Furthermore, a randomized controlled trial established the acceptability and feasibility of the AVP Cancer-Free Parent Education app among parents, and it was found to be effective in increasing parental knowledge of and positive attitudes towards HPV vaccination. Next slide. And due to this success, we developed the Adolescent Vaccination Program Implementation Tool, or AVP-IT, to enable pediatric clinics to adopt, implement, and maintain the AVP on their own, regardless of clinic size and EHR type. The website provides detailed guidance, resources, and tips to implement the evidence-based AVP strategies and increase HPV vaccination rates. The AVP comprises 4 components. The About AVP-IT page provides an overview and background on this successful program. It includes a description of website components, tips for best use, and current AVP publications and results from our team. Next slide. For the biggest impact on HPV vaccination rates, we recommend clinics go to the My Action Plan page. Users complete an action plan wizard that comprises 12 questions about their clinic, their current HPV vaccination activities, and they then receive an action plan that's tailored specifically to the needs of their clinic. Next slide. And this is an example of the tailored action plan. So the first page includes a clinic profile that identifies the level of implementation the clinic is currently at for each of the evidence-based AVP strategies. The rest of the action plan provides background on each AVP evidence-based strategy, step-by-step guidance to implement the strategies in their clinic, templates and resources to facilitate implementation. It also gives tips for success. Next slide. The My Toolkit page allows users to explore the strategies on their own and select from the array of resources available. It also includes video testimonials from providers who have experience implementing each of the AVP strategies in their clinics. Next slide. And both the tailored action plan and My Toolkit contain a selection of valuable resources for increasing HPV vaccination rates. One unique resource that we want to point out is our tailored assessment and feedback templates. Clinics can select a template depending on the number of providers in their clinic. After entering data on adolescent vaccination rates into the data entry tab of the worksheet, a clinic report as well as individual reports for each provider in the clinic is generated. Clinics can then print out these reports and distribute them to clinic staff as part of their assessment and feedback program. Next slide. And finally, users can visit the Contact Us tab if they have any questions or need support when using the program strategies. Next slide. So in this way, the AVP incorporates 3 key ways to improve HPV vaccination rates that are recommended by the CDC. The first is to know what your rates are. And this is incredibly important because we can only improve what we can measure. Your clinic may be able to use data from the CDC's assessment, feedback, incentives, and exchange or AFIX program. Pull data from your electronic medical record or immunization information systems, or examine the HPV vaccine ordering data by looking at the ratio between the amount of HPV vaccine ordered to the amount of Tdap vaccine ordered, because you only get 1 dose of Tdap vaccine per adolescent, whereas you should be getting 2 or 3 doses of HPV vaccine for each adolescent, depending on which age they initiate the series. Your AVP-IT action plan will provide more information on these methods. It's also important to align office policy with the mission to increase the numbers being vaccinated. This means that you commit to immunize at every opportunity and that you utilize evidence-based interventions. And finally, and importantly, you need to make sure that all clinic staff, including those answering the phone and making appointments, are communicating the same way about the HPV vaccine so that messaging is consistent. It's important to put the focus on cancer prevention and provide easy talking points for clinic staff. Our AVP continuing education includes case simulations that model patient-provider communication and also provides guidance on how to respond to specific parental questions and specific forms of parental hesitancy. I'm going to thank you all for attending our Adolescent Vaccination Program Implementation Tool webinar. This slide shows our team. And our team are excited to disseminate this program to pediatric clinics throughout the state of Texas and hopefully beyond. Our goal is to make the program accessible to clinic administrators and healthcare providers so they can easily adopt and implement evidence-based strategies in their clinic and increase vaccination rates. Please feel free to reach out to our team anytime at the Adolescent Vaccination Program at uth.tmc.edu.